Our next presentation is S070, New Skill Evaluation System based on hand motions during the performance of laparoscopic surgery, to be presented by Dr. Uemura.
Okay, thank you, Chairperson. Okay, we have no disclosures. Okay, as you know, the laparoscopic surgery has many advantages such as less scarring, area recovery, and cosmetic advantages. However, laparoscopic surgery is hard to learn for the beginning surgeons. So our previous work focused on the hand motion of expert and novice surgeons during the operation. So the kinematic data describing the motion of a surgeon for steps during a skill assessment task were analyzed mathematically, and we found new evidences on the hand motion during the laparoscopic surgery. So this method enabled surgical motion of the expert and novice surgeon to be assigned objective numerical values. Refer to my paper in details. However, it is not clear whether these values accurately reflect the surgeon's skill during the actual laparoscopic surgery. So this study investigates whether these newly described factors were accurate assessment of the skill in performing laparoscopic surgery. First, we constructed a chaos neural network system to distinguish the experienced and inexperienced surgeons. The network consisted of 3 layers: an input layer, a hidden layer, and output layer. So in the input layer consists of 8 previously identified input factors like this. And hidden layer consisted of 30 neurons, and output layer is 2 neurons identifiers, such as 0 is expert and 1 is novice. The second, to optimize this system, 38 surgeons were enrolled. Each person who was enrolled was obtained in our previous study. So data were trained until the 2 groups of the surgeons were correctly distinguished again and again. Then a blind test was performed to evaluate the newfound factors using the optimized system. So brand new 29 examinees were enrolled in this study. All examinees had not been included in the previous study. So in the expert group, 12 expert surgeons, and the novice group, 17 young surgeons. All randomized data were inputted into the system, and the system was analyzed for its ability to distinguish expert from novice surgeons. So with the primary outcome being success rate. Okay. So this is the result. So optimization of the neural network system during mechanical learning was completed at 12.7. The correlation between the input supervised learning data and output data was 0.99. And yes, the correct judgment rate was 0.99. So this slide shows the output of the network. A part of the dark gray is expert element, and light gray is novice element. In each bar was computed by the neural network. While the surgeons number 1 through the number 12 were actual experts, and number 13 to 29 were also actual novices. The system had correct judgment rate of 79%. 79.3% in distinction between expert and novice surgeons. So how do we improve the correct the judgment rate of this system? So we will input these results to the optimized system as a trained data and perform retraining again. And we consider about the trial and improvement method is the best way to construct a high accuracy neural network. And now I'm developing a real-time skill assessment system. So this system will be able to assess the skill during the surgical simulation task by hand motions. So stability, flexibility, and biomanual coordination will be able to assess. So this is a prototype, so it will become available soon. In conclusion, so using the factors identified during our previous study, so the neural network system was able to distinguish between expert and novice surgeon, and both from the surgeon with unknown skill levels. So however, the higher judgment rate of the system is needed. Okay, that's all. Thank you.
So this paper is open for discussion. So is your software analyzing the surgeon's hands, or is it analyzing the tip of the instruments? Because it looked like it was the tip of the instruments.
Yes, yes, of course. So we use the magnetic sensors with the 6 DOF, so X, Y, Z, and low PTO during the operation. So it can assess, it can measure the coordination trajectories. However, so I use just the magnetic tracker to measure the hand motion. Right.
Did you include people that are both right-handed and left-handed in your study, and was there a difference in the predictability of those two groups?
But I'm sorry. So please again. What
So he asked, do you have right-handed
Right and
surgeons
left-handed?
left-handed surgeons? Any difference?
Did you check
between-
any difference?
Yeah. So very so.
All of them were right-handed?
Maybe no. Maybe all. Sorry, so I didn't check the right hand and left hand. However, maybe it is not really differences. However, not. I think the right hand person and left hand person of the hand motion is maybe same behavior in this analysis, right? Is it good?
I don't think, observing people, left-handed people, it seems that the motion may be different, and that's why I was wondering. I think it may be interesting at least to record when you test people whether they're primary right-handed or left-handed, and see if the algorithms allow you to predict with the same accuracy.
Yeah. Yes. So it is true. However, in this analysis, so we don't care about it. So this has not based on the trajectory. However, I calculate by the chaos mathematical method, so we can omit the right-hand person, left-hand person. So is what to say. So it is difficult to explain in English. Sorry.
Thank you.
Thank you very much.